care, and we have done around 42,000 tests. That's the update in terms of the numbers. If there's any questions about that, Brett can deal with those. We've got a very simple message today. Stay at home. Victoria has moved to stage 3, and that involves a ban with an on-the-spot fine of more than $1,600 if you breach it on gatherings with more than 2 people other than those in your household. This is critically important. We cannot have people out socialising, gathering as if this wasn't happening. We've got to protect the health system, and we've got to save lives, we've got to protect jobs as well. This is very, very important that people do the right thing. Beyond that, there are 4 reasons to leave your home: to get medical care, to go to work, for your daily exercise, and to go and buy the things you need when you need them. Not to be window shopping, not to be going and buying things that you don't need. If everyone follows these rules, and they are as simple as they can be, then we will slow the spread of this virus, we will save lives, we will protect our health system, we will get through this together, and we will get to the other side of it quicker. That's the key message today. Stay at home. If you are outside or in your backyard gathering in more than 2 people, if you're having friends over for dinner or friends over for drinks that are not members of your household, then you are breaking the law. You face an on-the-spot fine of more than $1,600, and Victoria Police will not hesitate to take action against you. That's how serious this is. No one in my position enjoys doing this. We're not doing it for any other reason than this is life and death. If we allow our health system to be overrun, then people will die, and that is a price that is just not worth paying. No gathering with friends is worth someone's life. And I again make the point, whilst many vulnerable people are at the highest risk, there are other people who have been otherwise healthy, no pre-existing medical conditions, in their 40s and 50s, who have died in other parts of the world. This is not just about grandma, this is about all of us. This is about all of us. And unless you want to be burying an elderly relative, or your best mate, or your parents, if they're younger, then do the right thing. It's very, very simple. Stay at home. Nothing could be simpler than that. Those 4 reasons cover all the things that you would need to do. Beyond that, if you don't need to be outside, away from your home, you shouldn't be. You simply shouldn't be. And if we continue to see the bad behaviour that we saw over the weekend from many, then all we will do is spread the virus more quickly. That is not the objective here. Quite the opposite. We want to slow the spread of the virus, flatten the curve, if you like, preserve our health system so it can cope, and ultimately save lives. That's what's most important. I again reiterate, stay at home, follow the rules, keep your distance, wash your hands, cough into the crook of your arm, just use common sense and some common decency. Do the right thing or people will die. Now, we're more than happy to take any questions you have, but just before, I should just confirm those arrangements, those orders, they will be made effective from midnight tonight. So whilst people won't be getting an on-the-spot fine if they're in groups of more than 2, not including their own household, I'd urge people to do the right thing from now. After midnight tonight, you very much face the prospect of an on-the-spot fine. Happy to take any questions you have.
Are we at all close to a state of disaster being declared?
Well, that'll be done on advice. The reason you move to that level is if there's any doubt that you've got all the powers you need. The state of disaster provisions give to me and to the government absolutely extraordinary powers. We think we have all the powers we need at this point, but I don't rule that out. And if we do move to that stage, then I'll be back before you and I'll explain why.
Is there a thought that the coronavirus patients shouldn't be going through general hospitals, ICUs, EDs, GPs? They should be going to centralised, perhaps private hospitals, so they to protect the family of the medical staff, their
Sure.
families and other patients.
I'll let Brett speak to that because there's a whole range of protocols. Just before I do that, can I say that we're very pleased to have spent quite a lot of time over the weekend working with the private hospital sector. I know there's been a lot of talk about the challenges that sector faces. We have an in-principle agreement to stand behind those private hospitals to make sure that they're viable, and then to have all the capacity that we need reserved for any COVID-19, any coronavirus patient that needs that care. I'm really pleased to be able to report we've got a deal that sees the health system, public and private, work as one system to provide the very best care. There's one further point I'll make. There were some nurses at the Epworth, I think, and Cabrini, who were not required for care within that hospital setting. We've employed those people. We've got them doing contact tracing. They've got a unique set of skills. We're making the best use of the best skills to make sure that we fight the spread of this virus. But the breakthrough and the very positive work around private hospitals, I want to thank Jenny and her team and everybody involved. One health system, not public and private, but one health system to provide one consolidated response and the very best of care. I might let Brett speak to your question, Brendan, about clinical protocols and settings.
Is there a need for a one stream for testing and then treatment to keep them away from the public setting, public hospitals?
I think largely we've definitely moved to a stream for testing. Obviously, with all the standalone clinics where people can get tested, you're looking at people with upper respiratory tract symptoms, and so they are getting tested separate from emergency departments. But people will be presenting to emergency departments even with things that are not respiratory illness that could have coronavirus. And so to the fullest extent possible, they are trying to stream within health services anyone who has compatible symptoms, so that they're kept away both in waiting rooms but also through all of their care pathways from all other patients. We may get to a point where the level of infection in the community is so great that we have standalone health services, but at the moment, with a relatively low proportion of people with compatible symptoms with confirmed coronavirus, the streaming within health services is the appropriate method.
Those standalone, would they be greenfield startups or existing private hospitals? Or
I think there'll be a combination. I think everyone is looking to be as agile as possible, work to the circumstances of where the cases are occurring. If they happen to be in a place where they're not well served by a health service that's very nearby, they might be a new stand-up service. But mostly I think they'll be set nearby health settings because people go there normally.
What should GPs do if they get the phone call? Should they refer potential patients on if they think of a COVID-19?
I think a lot of GPs have the personal protective equipment, the confidence and the competence to do testing themselves, and we encourage them to do so. For those who don't feel that they have the capability, they may be referring to other settings such as the standalone clinics, but we certainly think that GPs play a critical role in testing and in care of these patients.
Professor Sutton, on the weekend you said that some of the behaviour of Victorians was crap. Why is that? And would you say that occurred yesterday as well?
I think so. I don't want to vilify any one individual. What I want to call out is the behaviour that will lead to transmission of this virus. And hundreds of people gathering together, hundreds of people driving down to one location is exactly the kind of setting where transmission will occur. And I'll make the point again, you may have very mild symptoms. You may have no symptoms at all, but it'll be somebody else nearby you. And if you're gathering together in large numbers, you are putting yourself at risk, but maybe even more importantly, you become the infected person who puts other vulnerable people at risk. So avoiding these settings, doing the right thing in terms of behaviours, saves lives. It might be your own, but it's much more likely to be those of your elderly parents, your elderly grandparents or your neighbours. So do the right thing for everyone.
You were pretty frustrated, weren't you?
I was frustrated. I think some people haven't had the awareness, but some people have the awareness and still can't see that this is the time to act. This is our window of opportunity. We will go to a point potentially where everyone is calling for this because we can see that our health systems are overwhelmed. That is too late to act. This is our time to do the right thing, to avoid transmission, because now, when levels are relatively low, is a point where we can totally flatten that curve. We could cap cases in Australia at 10 to 15,000. The alternative is hundreds of thousands, and that means hundreds of deaths or thousands of deaths. So to save hundreds and thousands of lives, this is the time to act.
Can you talk us? How do you
Victoria's rate of testing now is up there with all the best testing rates in Australia and indeed across the world. So we're at 3,000 to 4,000 tests per day. On a per capita basis, that's as high as anywhere. And right up there, as I say, with some of the highest testing rates across the world. Our private labs were a little bit slower to come online, and so our reference lab, the government-supported lab, was doing the bulk of testing. But now there's a lot of testing going across the board. We have focused on those who travel internationally. More recently, certainly in the last week or two, we've done much broader testing, including those who haven't travelled. I think we've done the right thing in terms of our messaging, in terms of mostly the behaviours that are required to slow transmission in Victoria. And so I think we are doing as well as anywhere in the world now for flattening the curve. Where there are settings like New South Wales, where there are lots of cases, a lot more testing has had to focus on those areas. And so they have tested the 10, 15 close contacts of every case that they've had. That's a requirement of testing when you get a positive case. We have had fewer cases in Victoria, that's a good thing, but no complacency here. We continue to increase by 50, 80, 100 a day, and that will continue until we can really bring in the physical distancing that we're really emphasising.
Can you talk us through the modelling that if nothing changes as what we're seeing at the moment, where we end up in a week, 2 weeks' time?
Well, really, we're still looking at a 10% increase per day nationally. That's an improvement on where it was, but it's still a doubling every week. So we don't want to go down that pathway. We have to improve to a point where that curve is entirely flat. If we're not doing the right thing, that increase could be 25, 30% per day. That will lead to 100,000 cases in a few weeks' time. So I think we're heading in the right direction, but we are not there yet, and we will still double every week until we do more, until we embed all of the things that we're emphasising this morning.
Thank you. Premier, can I just ask, on the spot fines have been in place for a while. Firstly, how many on the spot fines have been issued so far? And secondly, do you have police patrolling skate parks, playgrounds, and make sure that
So last question first, yes, police will be out and about. There's a 500-strong coronavirus task force. They're doing their important work. The other thing to remember, people shouldn't need to be reminded in these terms, but I'll do it anyway. There's 500 police dedicated to this, but every general duties officer knows and understands what these rules are, and they won't hesitate to act either. In terms of the number of fines, I know police have been out and about. You've all covered it. We've seen it. The number of fines and the specific actions that have been taken, I'd leave the Chief Commissioner to update you on that. But I think after midnight tonight, once we move to the two-person rule, so no gatherings other than members of your household with more than two people, I think we're going to see, well, hopefully no fines need to be issued. The police won't hesitate to do that, and the fine is a very significant one, more than $1,600 on the spot. No questions asked. This is just going to happen. They're not mucking about, because this is very, very serious. Very serious. We simply can't have our health system overrun. We can't have people die. We need to do everything we can to reduce the spread of this virus. People doing the wrong thing just spreads the virus. This is very, very simple, and hopefully this message starts to get through to people, together with the fact that it is a criminal offence. It is an offence against the Public Health and Wellbeing Act, and you will be fined.
Just to clarify, does the two-person rule apply inside and outside?
It applies everywhere. So, for instance, you can't be having half a dozen people over for a dinner party, nor a barbecue in the backyard. You can go for a bike ride with members of your household or two people only, but you can't go your normal cycling on a Saturday morning or whatever day it is with 15 friends. That is not doing anything other than spreading the virus. Now, I know some of these rules, I've heard people say they're very, very complex. Well, look, this is what I'd say. There are many complex things in the world. This is not one of them. Stay at home. It can't be simpler than that. If you haven't got a good reason to be out, shopping for food, what you need when you need it, going to work if you can't work from home, getting your exercise, limited exercise, not a day at the beach, but perhaps a short walk at the beach. If you're not doing any of those things, then you should be at home. This is very, very simple. If we don't all follow these rules, people will die.
Premier, last week you said that it was okay to go down to your holiday house if you stayed inside. Is
is that still the case?
There's no prohibition on people going to properties they've got a lease over or properties that they own. I'm not going to get into the kind of trying to enforce beach house rules. I think that we've got lots of rules. I think they're quite simple. Stay at home unless you need to leave your house to go to work, to buy the things that you need, to get medical care, or for that limited daily exercise. I don't think there's no purpose, I don't think, in diverting police resources to look at those sorts of issues. However, I would ask people to be as considerate as they can be of smaller regional communities, smaller coastal communities where there might not be, the sort of supermarket of size. Everyone needs to be considerate of each other. Everyone needs to do the right thing. And if we all work together, if we all have that sense of civic duty, common decency and common sense, then we'll get through this and we'll get to the other side quicker. That's the real key here.
Just in terms of work, in a work setting and gatherings, like
Yes.
take here as an example, we're all spaced out,
And
and
you-
social distancing.
Yes.
Is that the guidelines? Because some workplaces, construction sites, have multiple people on
That's right, work is not included. The two-person rule does not apply if you are going to work, or if you're going to university, or if you're going to TAFE. Schools are closed for the holidays. Again, these are quite simple, and I'll be indebted to all of you if you can put this up on the screen again tonight, or print it in your papers, have it all there clearly. It is very clear. As I said before, there are a lot of complex things in our world. This is not one of them. Stay at home. The message could not be simpler. If you don't, people will die.
Premier, just what you expected when you said stage 3 last week, because the public expecting more.
Well, people have interpreted, and I've been keen not to add to the sort of some of the commentary about what could be included in stage 3. Again, at each point, I've been really clear with people. We've taken big steps, really big steps. And if you ask somebody who used to have a job at a pub, or someone who owns a pub and has still got to pay the bank for all the loans they've got, whether that was a big step, I think they'd say yes. If you ask people that work in the beauty industry or the gym industry or any of those businesses that were closed as part of stage 2, is it a big deal and a big step? The answer would be yes. And whenever you start dictating and mandating the sort of behaviour that is lawful and unlawful as we have today, that is a big step as well. Will there be a fourth step? I can't rule that out. I cannot rule that out. For so long as we see people doing the wrong thing, for so long as we see additional cases each day, then we're going to have to consider taking next steps. Now, I will just add, the two-person rule and the 4 reasons to be outside your home, otherwise known as stay at home, that'll be legislated here. That is a Victorian response. Not every state will necessarily move to this level. New South Wales, I will, but I'll let Gladys speak to that. The National Cabinet, and I don't want anyone to be writing up that this is some split. This is an appropriate acknowledgement on medical advice that the curve is different in each state, and therefore our response needs to be different in each state. It's no good pretending that this is the Northern Territory and we have, a very small number of cases. We don't. We simply don't. We're getting close to 1,000 cases, which means our challenge and what we have to do, all of us together, is very, very different to other parts of Australia and indeed other parts of the world.
Do you have
Premier,
to
what are
recall Victorian Parliament?
No.
And are there any plans to recall Victorian Parliament?
There will need to
should
be.
supply?
There will need to be an emergency sitting. There's been discussions with the opposition and the crossbench. I would hope that was a very short sitting that basically passed a bill that sees the monies, the normal monies that are spent and that are invested across the state, paying our staff and all those sorts of things. They would continue with a small increase, so it'll be unchanged from last year's budget. That shouldn't take very long at all. It won't be a day for politics. It'll be simply a day where we, and perhaps much less than a day, only a few hours I think at most, to get this job done. And I'm very grateful to other parties in the Parliament who I think have been engaging constructively with Jacinta Allen and others.
When's that going to be?
I have no announcement to make today, but it'll be done in good time. We've obviously got till the end of the financial year. But all the things that we've done to this point, back to your very first question, Simon, we haven't needed to go to state of disaster yet. When we do, we will, and I'll be only too happy to explain that to you at that time. And all the other things that we've done, they're either a function of the Public Health and Wellbeing Act or other acts of the Victorian Parliament. So to put it another way, The powers we've used are acts of Parliament, the laws of our state, operating the way that they should, giving us the power to take sometimes extreme measures and very big steps. But that's what's at stake here. There's no mucking around with this. If this virus continues to spread, people will die. If people ignore the rules, people will die. And not just people frail aged. I hear some commentary about, oh, well, they were probably going to die anyway. That's just not right. It's not right. In fact, and it's simply wrong on a number of other levels, can I say. There are otherwise healthy people in their 40s and 50s who have died in other parts of the world, and that will happen here if we don't slow the spread of this, if we don't all do the right thing. Stay at home.
Premier, to deal with private hospitals, could you just explain a bit about that? Is it a financial
There'll be
support?
some,
And would you like to see them being used to treat public coronavirus?
Well, what I'd say is we need one health system, whether it be public or private. And I'm very grateful to the biggest privates who have been working very closely with us over the course of the weekend. I'll leave it to Minister Hunt and Minister Makakos to make more detailed announcements. But we need to stand behind them so that they have got all the support that they need in terms of money to be there when they're not admitting all the normal patients they would admit. We can't have them closed. We can't have staff being stood down. So that just makes common sense. And that'll be a partnership between our government, all the states, and the national government. Beyond that, there'll then be a set of arrangements where we purchase beds and care, and we are able to access that for public patients, regardless of whether they have insurance or not. That's one health system, not two health systems, one health system providing one level, the highest level of care for those who need it the most. The detail of that will unfold throughout the day, but I'm very grateful to those private hospitals. Some are for-profit, some aren't, but they've done a great job in engaging. They are facing a serious challenge. I think we're equal to it, to build one system that can respond as a single system to provide the very best care regardless of whether people have got private health insurance or not.
Are there any plans to start quarantining health workers similar to what we're doing with overseas travellers to ensure that they're not being put at risk if they go home?
Look, I think there's lots of different advice being provided. It's there is a long list of advice that's being provided to healthcare workers in different settings. I'll leave that to individual arrangements at individual hospitals. But I think healthcare workers know how important they are when it comes to fighting this virus and saving lives. I want to thank each and every one of them. And can I just say, as important as our nurses and doctors and ambos and all of the clinical team are, the cooks and the cleaners, the orderlies, the front office staff at our hospitals, as well as the literally hundreds, indeed more than 1,000 people who are working at different offices across the city doing contact tracing, that critically important work fighting the spread of the virus, finding everyone that a positive person has been in contact with and getting them to isolate, that's no less important than clinical care, and I thank every member of that team. They're doing a great job. We're going to ask a lot of them in the weeks and months ahead. What's really important is that all of us do the right thing so that they can cope, so that they are not overwhelmed, so that they don't have to make that wickedly difficult choice between which patients live and which patients die. Because if this gets away from us, we will never have enough ICU beds. Have a look at Italy. There are parts of the world where there's simply, you could never have enough ICU beds if this thing gets away from you. That's why we all have to play our part. That's why we all have to do the right thing, keep our distance, follow those really basic rules, wash your hands, stay at home. That is the key message.
Premier, just to clarify, not every state and territory is adopting this two-person rule. Is that what you were saying?
Well, I'll leave it to individual states to make their own announcements, but the point that I'm making, as has been foreshadowed by the PM and by each of us, I think, over the last week or so, different states are in a different place. The curve is different in each state, and therefore we have to take what action that's appropriate for Victoria. That doesn't mean that that action would necessarily be mirrored in the Northern Territory or WA or South Australia. Again, different states are at a different place. For instance, New South Wales has the largest number of cases. We have the next largest number of cases. That's very different to Tasmania, very different to the Northern Territory. I just think it's fair that all of you are fully aware and understand, and hopefully get the message out to your readers, to your listeners, to your viewers, that not every state is in the same place, and therefore I think you'll see in the weeks ahead that things will be different in different parts of the country based on the challenge that different parts of the country face.
But the Prime Minister said these restrictions work for everyone in Australia, so what's different in Victoria?
No, they are not. Individual states will make their own announcements about whether they're going to the two-person rule, for instance. I'll leave it to them. Ultimately, the rules we make are for people that are in Victoria. So I'm here to make the point that there are different treatments, different responses, different steps in different parts of the country. I think it's just fair and reasonable to let people know that. That is not a criticism or a commentary on anyone else across the country. It is simply a reflection of the challenge that we face, and to a certain extent New South Wales. Again, you'll have to look at what announcements are made today or have been made overnight. We all may go to 2 from an abundance of caution, but we're doing in Victoria what we know to be appropriate to the challenge that we face. That's the simplest point.
Public transport, Premier, will that remain as is? And is there a subsidy being looked at for Metro? Or?
We're working with many different businesses across the state. Many businesses are having very significant impacts to the sort of income that they have. We're providing, just as we're providing support to businesses who are closed, we're also working with businesses that provide services that we really can't do without. So there's ongoing discussions with the private transport operators. I'll leave it to others to keep you updated on those. In terms of PT, we may go to a situation where there is a limited timetable, something that looks more like a Sunday timetable, for instance. But I again want to reassure every Victorian there are hygiene protocols, extra cleaning going on, all sorts of steps are being taken, the right steps, based on the very best clinical, medical advice to keep everybody who might use public transport safe. But again, you should be using public transport only if you have to use public transport, because you should be staying at home unless you're going to work, going to get medical care, on your daily exercise, which should be limited. These all going shopping for the things you need when you need them. If everyone follows that simple rule and doesn't gather in groups of more than 2 other than your immediate household, we will stop the spread of this virus. We'll certainly limit it, and that will save lives.
What's the latest advice?
There's no change to the arrangements there.
And evictions,
If and when they do change, I'll take you through that.
evictions, is that...
Yeah, sorry, I should have mentioned at the top. We put a moratorium on any landlord evicting a tenant, whether it be a commercial tenant or a residential tenant. We want those tenants to work together. There'll be many people who can't pay their rent through no fault of their own. There's also tenants who have got to pay the bank because the property is not free and clear. There's a mortgage over it. That's why the banks have got a part to play in this. The Prime Minister made this clear last night, and I'm sure that the national government is speaking to all of the banks as we are. Beyond that, landlords have got a role to play as well. They've got to have to share in some of this pain, and indeed tenants will as well. Coming to an arrangement, common sense, that's the most important thing. There's no landlord benefits from a tenant walking away, ripping out all the fittings and furnishings in a retail store. No one benefits from that. Ultimately, a deal, a common sense deal where everybody shares in the pain of this time, that's where there'll be an ongoing business, an ongoing tenancy, and an ability for that business on the other side of this to pay rent and to employ people and to provide the goods and services that every Victorian needs.
Under the Wellbeing Act, or how's that enforced?
No, we'll have more to say about exactly how we give effect to that. There's a range of different laws in the state that we can use, but I'll have more to say about that. But no one who's a commercial landlord or a residential landlord should be evicting anyone. We are very, very firm on that. It's simply the wrong thing to do. It's not very smart either, frankly, because the notion of getting a new tenant in these times, I would have thought was very, very limited.
And is there a dob in line? Do you see parties going all the time? Who do you call the police? Or
Yes, and police won't hesitate to act. I've heard lots of anecdotal stories over the weekend. People having parties in their backyard. Police turned up and police took action. Ultimately, we are all in this together. And I've heard a lot of this commentary, it's all too complex. Many complex things in the world, that's absolutely true. This is not one of them, because the message is very simple. Stay at home or people will die. I can't be clearer than that. I'll be back to see you tomorrow. We've got National Cabinet tonight. Any other issues, by all means ask us, and we're happy to provide you with whatever information we can. Thanks very much for being here.